Do you feel like you're paying for health insurance but just not getting the value out of it? Here's the truth. Most people don't know how to use their health insurance to their advantage. And because of that, people waste hundreds, sometimes thousands every year without realizing it. The good news? Once you understand how the system works, you can flip it for your advantage. In this module, I'll show you simple insider strategies to save money with your health insurance, things most people don't even know exist. By the end, you'll know how to cut costs, avoid traps, and use the benefits you're already paying for. The agenda for this module: in-network rule, billing codes matter, appeals work if you know how, generic versus brand prescriptions, leverage free extras, hidden saving opportunities, pro tip roundup, case studies, closing, and next step. Before your last visit, did you verify both facility and every clinician were in network? If surprise bills arrive tomorrow, which part of care would you double check? In network rule, the single most powerful way to save money and the one people ignore is the in network rule. In network means your plan negotiated lower allowed prices for specific doctors, hospitals, and labs and applies your in network copays and coinsurance. Out of network often means a higher patient share, and some plans don't cover it at all except emergencies. Here's an example: your doctor's list price for a visit might be $300. If they're in network, the plan's allowed amount could be far lower, and you typically owe only your in network copay insurance. If they're out of network, you could owe much more, sometimes the full charge, depending on your plan. Here's a pro tip: even if the hospital is in network, the ER doctor, the anesthesiologist, or radiologist might be from a separate group. Confirm both facility and clinicians when checking in or scheduling. Now, did you know the No Surprise Act of 2022 protects you from many balance bills for emergency care and for some non emergency services at in network hospitals and for most air ambulances? It does not apply to ground ambulances in most cases and has other exceptions, so you still need to ask. Before a visit or procedure, ask: are all providers involved in this care in network for my plan? That sentence alone can save you hundreds. Have you ever compared your itemized bill to your explanation of benefits to see which codes drove the charges? Was your last annual visit billed as preventative or diagnostic? Billing codes matter. Here's a secret: your bill isn't built from words, it's built from codes, diagnosis codes, and procedure codes. If a code is wrong or too broad, a visit that should have been low cost or preventative at zero can become expensive. Here's an example: annual preventative visit for most ACA compliant non grandfathered plans in network are generally zero cost share. But if the visit is coded as diagnostic, like and evaluate a specific problem, cost share can kick in. Now, here's a pro tip: after a big visit or test, ask for an itemized bill. Check the service descriptions and the dates, and ask for your provider's billing team to review if something looks off. Sometimes a coding clarification fixes the charges. Now, here's something to look at. Emily got a $400 bill for her annual checkup. She called and learned it was coded as a problem visit because she mentioned knee pain. The office split the visit correctly, preventative plus problem, and adjusted billing. A 5-minute call saved her $400. Did you know billing and coding errors are common? Review your itemized bill and your explanation of benefits is one of the fastest way to catch and correct mistakes. Don't just look at the total, look at the codes behind it. One wrong line can cost you big. If a claim was denied, do you know why and how to follow an appeal? Which documents would you attach first? A doctor's letter, corrected codes, or proof of authorization? Appeals work if you know how. When a claim gets denied, many people assume it's final and pay it. The truth, many denials get overturned when you follow the steps. Read your EOB to see why it was denied. Medical necessity not covered, coding mismatch, prior authorization missing. Check for errors, wrong codes, wrong dates, provided out of network and error, missing notes. File an appeal. Your plan must provide instructions, often on the back of your EOB or your portal. Attach documents, doctor's notes, clinic notes, corrected codes, prior authorization proofs. Now, here's an example. Ben got a $1,200 bill for a sleep study. Insurance said it wasn't medically necessary. His doctor wrote a note documenting severe snoring and high blood pressure. The clinic resubmitted and it was approved. Now, here's a pro tip: keep EOBs like receipts. They are your proof of what was processed and why. Did you know plans must offer internal appeal process? And when certain criteria are met, you may be eligible for external review by an independent organization. When insurance say no, don't assume they're right. Sometimes it's missing documentation or codes. At the pharmacy, do you ask, is there a generic or a formulary preferred option? If no generic exists, what is your plan B? Generic versus brand prescriptions. Prescription prices can vary widely. The fastest way to save is to ask about generics. Generics have the same ingredient strength, quality, and effectiveness as brands, but cost far less once patents expire. A brand name cholesterol drug might be $250 a month. Its generic could be under $20 a month. Many plans use drug tiers. Tier 1 generics, the lowest copay and coinsurance. Tier 2 preferred brands, moderate. Tier 3/4 non-preferred specialty, highest. Now here's a pro tip. If there is no generic, ask if there's a therapeutic equivalent, a different drug in the same class, or a formulary preferred brand. Did you know 9 out of 10 prescriptions filled in the US are generic, often up to 85% cheaper than brands? Ask every time, is there a lower cost version of this? One question can save you hundreds each year. Which $0 benefit are you not using? Preventative care, telehealth, nurse lines, wellness perks. What appointment or screening could you schedule this week at no extra cost? Leverage free extras. Many plans include low or no cost benefit designs to keep you healthier. Telehealth. Many plans cover virtual visit at low or zero copay for common issues like rashes, sinus infections, and refills. Preventative care. Most ACA compliant non grandfathered plans, many in network preventative services, annual checkups, recommended vaccines, certain screenings are zero cost share. 24/7 nurse advice lines. Call for guidance, urgent care, or wait for my doctor. Employer wellness perks, gym discount, nutrition, counseling, and coaching, mental health resources, and more. Here's an example. Karen put off screening colonoscopy thinking it would cost hundreds. Under her plan's preventative benefit, it was zero in network. You're already paying for these benefits. Not using them is like paying for a gym membership, never going. Before your next test, will you compare facility prices or just go where you're sent? Have you planned timing around your deductible yet? Hidden saving opportunities. Beyond the obvious, here are the insider moves. 1. Compare prices before test. Call imaging centers, labs. The same MRI can be hundreds versus thousands depending on the facility. Ask for an estimate. You can also ask for the self pay cash price. Also important, if you choose to self pay and the provider doesn't submit a claim, that amount typically won't count towards your deductible or out of pocket maximum. Ask how they'll handle it before deciding. 2. Time your care before your planned year. If you already met your deductible, scheduling elective care before your planned year ends can lower your out of pocket. Many plans are calendar year. Some employers use different plan year. Check yours. 3. Ask about financial assistance or payment plans. Many hospitals and clinics offer income based discounts or interest free payment plans if you ask. Now, here's an example. After surgery, Leo owed $1,800. Instead of a credit card, he set up a 12-month no interest plan with the hospital. No stress, no fees. You don't have to be rich to manage medical costs, just informed and proactive. If you only did 2 of these a month, which one will save you the most? What reminders will you set so you can actually follow through? Let's take a look. Pro tip roundup. Quick recap of the biggest money savers. 1. Confirm in network before visit. Ask for itemized bills to review codes. Appeal denials. Don't just pay. Choose generic or formulary preferred drugs when possible. Use zero preventative care, telehealth, and wellness perks. Compare prices and request payments if needed. Insurance can feel complicated, but knowledge equals leverage. Let's see which case looks most like your situation: chronic meds, a denial, or underused plan extras. What single step from these stories can you copy this week? Case studies. See how these add up. So, case 1, Maria, the teacher. 3 chronic meds, switch all to generic. $90 a month, save $1,000 a year. Case 2, Kyle, the new dad. $1,200 ER visit for baby. Check EOB, coding error, appealed, charges reversed. Case 3, Leanna, the freelancer. Use plan extras, virtual therapy at $0 via employer sponsored benefit. Save $120 visit and got consistent care. Every small win counts. The system rewards people who ask questions and follows up. What's the first money saving move you'll make? Verify in network, request an itemized bill, or price check a prescription. Which benefit have you ignored that you'll use this month? Insurers seem to have the upper hand, but now you know you have the tools to push back. You now know how to check for in network providers, read and question bills, appeal denied claims, save on prescriptions, and use free benefits most people miss. Health insurance isn't just protection, it's a system you can learn, navigate, and master. Next up, we'll cover the best tools and resources, websites, apps, and calculators to track spending, compare plans, and make smarter decisions all year around. I will see you in the next module.